Hello and welcome to Addiction Recovery Revolution. On this summit, I'm pleased to introduce some of the movers and shakers that are in the integrative psychiatry area. There's not many of them, but I'm pleased to bring someone who is blowing up the East Coast with knowledge that people have not been introduced to, I think, often enough. Welcome, David Sheiderer.
Thank you very much, and it's great to see you again. And congratulations on your most recent successful summit.
Well, thank you.
What are we talking about today?
Well, you know, I wanted to bring you on because so many people, pyroluria is discussed and very many people don't really understand how prevalent it is, and the statistics of people that have alcoholism it's actually quite large. So just what it is and how people can go about actually getting the testing and get relief from this.
Okay, well, that's a great lead-in. Pyroluria goes by many names: pyrrole disorder, MOV disorder, cryptopyroluria. Really what that means is it is the accumulation of an abnormal amount of an otherwise natural and normally occurring breakdown product of hemoglobin, which is, of course, a big part of your physiologic system that helps in the transportation of oxygen via blood, all of that stuff. At any rate, because of a inborn metabolic error that's genetically acquired, you simply cannot get rid of this accumulated excessive amount of this chemical, the pyrroles, in order for your body to kind of bind this and then eventually get rid of it. It uses up all your B6, vitamin B6, and all of your zinc. Now, this is just one more example of one of those pathophysiology-specific biomarker abnormalities that is associated with not only addictions, particularly alcoholism, but really myriad of our psychiatric disorders, myriad psychiatric disorders. And that would include certain types of mood disorders, bipolar disorder, ADHD, schizophrenia, really are big players. It's also involved in cognitive impairment. And so I'm always looking for not just urine for neurotransmitters, not just saliva for HPA axis activity, but also urine for these excessive pyrroles. And when you've got them, it's nice because it identifies a leverage point and it informs my treatment recommendations. That's the real point of testing. Does it really then influence or inform what I'm going to do with you?
I think that's, I know there's questionnaires online that people can go through, and it's alarming, like some of the common threads that you would think a lot of people that are, like you said, dealing with ADHD, bipolar. So it could be possible that people have this disorder, and by not addressing it, they're getting diagnosed as these other avenues of problems that they're dealing with, but really it can be addressed through supplements and through diet, correct?
Correct. Those are always great starting points. And that's not to say that I don't use plenty of medications when appropriate. What I find, like we've talked about before, Debbie, is that so often integrating natural and lifestyle related interventions with these hardcore medications allows the medications to work better, usually be better tolerated, and eventually allows me to get you off the darn stuff if that's safe and appropriate. So I'm almost always using supplements, nutraceuticals, lifestyle modification, plus minus medications. Now in the case of addictions, so many addictions start out as individuals self-medicating. I am using a substance to get through the day because I am having such awful mood symptoms, temper symptoms. I can't control my moods. I can't control my behavior, my impulses. What happens then if you're genetically loaded, that effort to alleviate your suffering by the use of alcohol or other substances, as you well know, turns into a secondary problem unto itself, i.e. an addiction. And now you've got two problems. You've got the addiction and you have the underlying psychoneuroimmunological disarray that led to the need for the substance in the first place. That's why so often, even if I can get you sober, darn it, I can't keep you sober because I'm not addressing the underlying chemical, hormonal, immune irregularities or imbalances. And that's why this is an important concept. This is one of those imbalances that is driving your propensity to drink too much or use too much. Not yours, of course, but one's. And that's why, boy, if I can get you sober, I want to keep you sober by addressing at a more fundamental upstream level these imbalances. And this is a biggie. I think this is one that's underappreciated, under-recognized. I myself have probably missed a boatload of it over the years. It's not the only test I would run on somebody, but it is certainly one of the biggies.
What are some of the symptoms of it?
Well, for me, because I'm a psychiatrist, people are going to come to me generally with mood symptoms, and so that's going to be depression or irritability or lability or reactivity. They're kind of a raw nerve, very sensitive. They're going to have fuzzy thinking. That would be the cognitive symptom domain. So their executive functioning is impaired. They have difficulty maintaining and sustaining their concentration and attention. They have a lot of mental fatigue, and so even if they can rise to the occasion for a brief period of time, they cannot sustain that. So that's that old mental stamina we talk about. There are then the behavioral excesses, and so that's where compulsions come into play, and addictions. I see a lot of addictions, and that takes the form of addiction to alcohol, to food, to the internet, to pornography, to work in our case, Debbie. We've got some work to do as well on ourselves. But yeah, I think that unless I'm able to customize treatment for the individual based on not just their symptom domains, but also on their underlying unique genetic endowment and their specific pathophysiology, i.e. what's going wrong with their biochemistry. Other symptoms, though, that are kind of fun, white spots on your fingernails, premature graying. Mine used to be premature. Now it's age appropriate, unfortunately, but a lot of inner tension, a lot of inner anger, poor short-term memory. Sometimes it can take the form of pain. So aches and pains, joints, just not responding well to exercise. So if you get that post-exercise payback that's exaggerated and extreme, then I know something's wrong with your neurophysiology, to include perhaps this accumulation of these pyrols or purols.
So how do you treat it then? I mean, once someone can get in contact with you, and it's as simple as they can actually get they can mail their samples into you, and they can actually be tested, correct?
Now, this is an easy urine test. We just measure the amount. In terms of treatment, there are a number of treatments, but this is a pretty easy fix. I wish all of the perturbations that people present with were this easy to fix, but high levels of B6 and zinc are generally mainstays of treatment because you're wasting or spilling all of your vitamin B6 and zinc to eliminate this excessive load of purols. But at the same time, rarely do we have such a utopian world where only one problem is at play. And that's why I'm not looking just at this test, but I need as many data points as I can to come up with a unifying theory for why you suffer and why you're dysfunctional, and at the same time then customize treatment. So we have specific supplements that we use a lot. We do not only urine testing for pyroluria, but also we look at urine for neurotransmitters, dopamine, norepinephrine, serotonin, GABA, glutamate, histamine, glycine, taurine. You get the picture. Do that all the time. I'm a big fan of testing your adrenals, i.e. your main stress apparatus. That's a saliva test for cortisol throughout the day, looking for the area under the curve, the slope of the line. And then I sit down with you. You'll be tired of talking to me by then, and come up with a customized treatment plan to include lifestyle modification, particularly diet, exercise, socialization, a spiritual component to your life. And I'm going to look at supplements and vitamins and minerals and nutraceuticals, plus minus medications. I don't do brain transplants, as I mentioned last time. anymore.
I would say I love you just because you're like Bill Nye the Science Guy of psychiatry, and you've got this wonderful personality that goes along that's so quirky, but at the same time, it's like you're so brilliant that half of what you say, you'll be like, okay, I don't know if I absorbed all that. Let me rewind it. And I think that's a great thing about these interviews is gives people just this little teeny sample of what it would be like, because most individuals, I'm speaking from my own personal experience, and I know most people have sat across from a doctor, and within 15 to 20 minutes, they're just writing you a prescription based off of the symptoms that you're saying. I can't sleep, or I can't focus. So taking it to this level, it really is a personalized plan. I mean, when you address it on this level, and that's the part I think that I've become so lit on fire about, I do energy healing, but this is the biochemical aspect that nobody discusses. Sure, they don't. And I really honestly believe, I mean, everyone will admit that, addiction is a brain disease or something going on in the midbrain. We all hear it. You sit in a rehab where you hear it, and then they drive you to a 12-step meeting, and you come back and they have rock stars in one hand and a vape in another hand. But nothing is ever really addressed, and if people understood the vital importance of diet and that supplements could greatly increase their biochemical dispositions to addiction, because I think that drives it, and it's just something that's the world as a whole, everyone will admit it, but how it's being dealt with it. And another analogy that was brought up was similar to Mother Teresa getting her leg broken, and we all gather around her and we pray and say, we really hope you get better soon, and walk away. We're not
more than that. May
right.
not. I'm not going to mess with her, of course, but yes, right. It may require prayer and, I don't know, a splint, or maybe,
Right. So there's two components. There's nothing wrong with the aspect of the spiritual, because that's absolutely, vital for a holistic approach. And this is really what it is.
It treats the whole person, right? I'm a very spiritual person, but I am also a biological entity and a psychological entity and an emotional entity. So we have to address all of those things with our individuals, particularly with substance use, addiction, because underneath all of that is a very usually sad and tormented and anxious and frightened human being that we got to attend to that whole person. And I think this is the way I try to do it. It does take a lot of time. You're right. My staff always is on me for hurry up, but you just can't explain this kind of, I guess, approach, and you can't come up with a personalized treatment plan unless you spend the requisite time with folks. But I wouldn't do it any other way. We got some great, I can't probably talk about it now, we got some great new addiction-specific supplements that help simultaneously support serotonin and acetylcholine and dopamine and PEA. There's one a lot of people aren't talking about, phenylethylamine. We got some really cool stuff regarding that for cognition, ADHD, and for substance use. So visit my website sometime, and I'll talk to you offline sometime, Debbie, about some of the fun stuff we got.
And I think that's really, I mean, when we're talking fun stuff, honestly, it's the product, like everyone is saying, well, great, now what do I do? So now that I'm no longer taking Adderall, what do I do?
Yeah, right. Well, come and see me. I've got a pretty brand spanking new supplement that I'm auditioning that combines PEA with ginkgo biloba to make that PEA last longer, just a little bit of caffeine. And we're using that as an alternative to prescription medication for ADHD.
Wow.
Good results. And yes, I take it myself. And I'm not sure that's a good testimonial for the
But I think honestly, anybody who endorses their own product, I mean, honestly, it's like the only way you know is when you try things and you can speak for yourself. Integrative psychiatry, why it's so responsible is it's not telling people give me, I'm replacing all medication. It is a responsible way of saying, what can we do to address these issues? Because many times people have addressed it in an abusive way using prescription medication, and now they can't use that medication. Right. So now they're in a form of kind of a withdrawal, their brain's in withdrawal, and they don't know how to address it any other way other than they keep going to meetings and they're thinking, I'm hanging on by the skin of my teeth. And this is the avenue by presenting individuals like yourself, like Dr. Hyla Cass. It's presenting people with saying, no, there are people who aren't saying you're crazy. It's just simply saying, here's some other avenues that will give you some holistic approaches, and if we need to, we can still use medication, but in other forms. It's just a responsible way all the way around.
Absolutely. And the person I just saw right before getting on the computer with you today, because I'm here in my office and seeing patients, and believe it or not, I have a mainstream psychiatric lecture on behalf of Big Pharma this evening in St. Petersburg, Florida. So I absolutely have my feet very firmly planted in each of these worlds because they are so important. And I can't customize treatment if I don't master them both as a professional. Anywho, so this is someone that's coming to me and already on medications, already in a 12-step recovery program, and really consulting with me, not for either of those two, but to say, hey, what is safe and effective to take with this medication? And we have data, right? So let's say you're on an antidepressant because you're depressed and now you're in a 12-step program. I'm not about to stop your antidepressant, particularly someone else has prescribed it by a colleague of mine locally. But what are the most commonly used data-supported supplements to add to an existing antidepressant, for example? Well, that data's there. Omega-3s, a certain form of L-methylfolate, methylcobalamin, B12. We use a lot of N-acetylcysteine, a good probiotic, and vitamin D3. So those are things almost automatically I'm going to do. Now, if there's any hint that you've got the old pyroluria, you're also going to get probably something with that extra B6 and that extra zinc. And then I'm going to test, if you're interested, just what those neurotransmitters are doing. I'm going to look at the urine for those pherols, and I'm going to look at your saliva. I'll send it to the lab, of course, but I'm going to look at that for your adrenal output, right? In addition to measuring your vitamin D levels and your thyroid levels and all the other good stuff. But this specialized testing is really hot right now. And Debbie, I'm so glad you've taken an interest in what we're doing out here in Sarasota, Florida.
I'm very interested, and I'm very happy that there's people like you, and I think it gives people viable solutions. I think it's also an epidemic in proportion in our country just to the types of foods that people are ingesting and eating, and not recognizing that over periods of time we have just become so, our brain needs to be fed just like any other part of our body. And we have an epidemic of heart disease, just like we have an epidemic of brain-related functions that aren't happening. And ironically, I always tell people the same thing that's really great for your heart, like omega-3s, is also very great for your brain. And people will think, well, it's fats, and I'll say, no, it's the right kind of fats. It's really that we're not consuming the right kinds of fats in our diets. So the more that people become educated on this and can recognize that they themselves can empower themselves with this information, and that's what's unique about your practice, is you go through an education process that's individual for each individual person. Right. So you're fabulous. I love your work. I love everything that you do. Yeah, you're just kind of like, you're my favorite doctor on the East Coast. But the reality is anyone can contract with you anywhere, and you do consult with people all over, everywhere, just like what we're doing right now. Correct?
Yeah, I just had someone in Costa Rica. I was able to use my telecoaching service. It's not telepsychiatry. I can't be their MD, their physician. I can't prescribe across state lines.
Right.
I'm licensed in Florida. I'm licensed in Virginia. But a lot of this education and a lot of the supplements and this specialty testing, all of which is on my website, then yeah, I usually have a consult, sometimes by phone. I prefer this eyeball to eyeball. And so I see people all over the country, indeed all over the world these days. So yeah, look me up.
Okay.
It look better the farther away you are from me. And so it's actually works better not to have to come to the office and see me, right?
Well, I'm always amazed that when you do this kind of interaction, it is very personal in a lot of ways. I think that people honestly, it makes it so that I think people can actually bring you into saying, well, this is what I'm taking, and, you know. But from what I've learned being a part of the Alliance for Addiction Solutions and learning about amino acid therapy, it is very individualized for each person. It isn't just an easy thing oftentimes. So I think your testing is dead on, that you're able to address it with formulas, giving people saying, you know, because that's what we're doing is based off of, but you're doing it based off of real scientific testing. So they're able to actually come in, walk out, and actually have something in their hand that says, no, I actually do suffer from this condition, or, you know, my adrenals are shot, or my hormones are way out of whack, and that makes sense.
I have people that when I review the results of their testing with them, they actually weep, they cry, they are so relieved that they're that I guess that much of a mess on paper, because they've been suffering for so long. Other doctors have said there's nothing wrong with you. The usual blood work or even fancy neuroimaging studies don't reveal anything. And that's why it's symptom-based subtypes, i.e. what are your symptoms, what are your behaviors, and then what we call these pathophysiology specific, not diagnostic specific, biomarkers. And that would be the things like the testing for pyroluria, that'd be the testing for amino acids, for neurotransmitters, for adrenal output, blah, blah, blah. And those then are not just of academic interest, but they identify things that I can actually fix or treat. And then the theory is, in so doing, I'm going to help your suffering. So relief of suffering, prevention of disease, promotion of health. That's kind of what we're about. And I think this approach is the best I've ever found in 30 years of practice in psychiatry.
Yeah, have you been always practicing integrative?
No, I'm fairly new to the game. I was an old academic psychiatrist, University of Virginia, very proud of those roots. But I just became dissatisfied, as I've shared with you in the past, Debbie, at how limited that particular set of tools is. Now, I still value them and I embrace them and employ them when it's appropriate for you, the patient. But boy, I'm so excited to be able to offer other things. There's
not very many though that you know ride the fence on both sides.
Very few. In fact, sometime out there, Google search just the term integrative psychiatry and see where we show up. And I'll bet even out there, I'll bet we're pretty close on Google to the first page. I think that gives you an idea of how few of us there are. So we're integrativepsychiatry.net. That said, just don't even put that in. Just do the organic search of integrative psychiatry, see where that comes up, and then you and anybody else that's interested, let me know. It's support@integrativepsychiatry.net.
Thank you. I appreciate you taking the time as always. I do. I really admire the work that you're doing, and I think that your brilliance comes across, and along with your wonderful personality. I mean, you have such a great personality that's paired with it, but you are answering a lot of viable solutions that people, it's as simple as, you know, doing some of these tests that people will get the answers that they're seeking and also find some solutions to help them. Because like I said, many people have abused the prescription drugs that they now can't take anymore. They've gone to treatment, they can't take them. So now all of a sudden they're kind of left with like, what do I do and how am I going to deal with this? And that's why I think so many people go back out and start abusing all over again.
Absolutely. Absolutely.
So I appreciate you taking the time. Let's give everyone, your phone number, your website will be linked obviously with this. But I like to have everyone be able to be in contact. So let's give us your phone number at least on there.
No, I had to get it. Okay, so I have an 800 number, but I don't know what it is. 941 371-7997. That's the office number.
Okay.
But go to the website, www.integrativepsychiatry.net, and that we have a 1-800 number as well. Would love to hear from you, and absolutely I can function in many, many different roles for all of your people, Debbie. They don't have to drive to Sarasota, Florida to see me.
Right.
They're welcome.
Well, I know that's absolutely the case. Nowadays, everything's opened up on the internet, and thank goodness, just because now, you know, you don't have to feel like if you're living in Idaho that there isn't someone that you can talk to or see to address these aspects of doing recovery. And this Brain Summit, like I said, the goal is just to further educate people on what integrative really means and what tools are out there and what individuals are out there that are practicing it and can help people.
Great.
So thank you.
Oh, thanks.
We'll talk to you soon, Dave.
Bye-bye.
Bye.